Hey guys, in this video I'm going to talk about the effects of male to female hormones on the body. If you are considering taking feminizing hormones, you should first learn about some of the risks and expectations. First thing to remember is that everyone is different, and the extent and the way that your body will change will depend on many factors, including your genetics, the age that you start transitioning, and the overall state of your health. It's also important to remember that everyone is different, so your dosage may vary widely from other people. Transitioning normally takes years for the full effects to occur, and taking higher doses of hormones will not make things move more quickly. However, it may endanger your health or even kill you. There are 4 areas where you can expect changes to occur as your hormone therapy progresses. The first one is physical. The first physical change you'll probably notice is that your skin will become a bit drier and thinner and have less oil production, leading to softer skin. And within a few weeks, you'll notice that odours of your sweat and urine will change, and that you may sweat less overall. After a few weeks of starting hormones, you'll notice small bugs developing beneath your nipples. These will be slightly painful to touch, but the pain will go away in the end, and it may be uneven between the left and right sides, but this is normal, so no need to worry. Breast development is different for everyone, so not everyone develops at the same rate, and every transgender woman can expect to develop an A cup or perhaps a small B cup, and sometimes only after many years of hormone therapy. Your fat will start to begin to move around your body, and your fat will start to collect around your hips and thighs, and fat underneath your skin throughout your body will become a bit thicker, giving your arms and legs less muscle definition and smoother appearance. The muscle mass will decrease significantly, as well as your strength. If you want to keep these, you have to exercise to maintain your muscle tone. Depending on your diet, genetics, starting weight and muscle mass, you may gain or lose weight once you start HRT. Hair on your body will grow at a slower rate and decrease in thickness over time. It may not all go away, but you can always have laser hair removal to reduce the unwanted body hair. If you had any scalp balding, this should slow down or stop altogether, where the amount that you lost will likely not grow back. Some people may notice minor changes in your shoe size or height. This is not due to bone changes, but due to changes to your muscles in your feet. The second lot of changes you can expect is emotional changes. Your overall emotional state may or may not change as it varies from person to person. As before, I never really showed any emotion, but now I laugh if I see something funny, or cry if I see something sad. While on hormones, you might find that you have access to a wider range of emotions or feelings, to have different interests, will behave differently in a relationship with other people. For sexual changes, soon after hormone therapy, you will notice a decrease in the number of erections that you will have. When you do have an erection, it will be less firm and will not last as long. You will still have erotic sensation and will still be able to orgasm. However, when you orgasm, it may be dry and your orgasms will feel different. With a more of a whole body experience, less peak intensity and longer duration. Your testicles will shrink to less than half of their original size or less. In nearly all cases, this does not affect the amount of skin available for future genital surgery. Within a few months of beginning hormone therapy, it is likely that you will become permanently or irreversibly sterile. If you're going to remain sexually active as someone who is able to become pregnant, you should always continue to use birth control to prevent any unwanted pregnancy. Most of the effects of hormone therapy are reversible if you stop taking them, but breast growth and being sterile are not reversible. If you have sexual reassignment surgery, you'll be able to take a lower dose of hormones. However, it is important to remain on at least a low dose of hormones post-op until the age of 50 to prevent weakening of the bones. Hello. Daisy! Daisy! Daisy, come here. Daisy. Daisy.